How to write a referral letter. Presented by Francesca Faith Viretrita from UMServe 2A. And today, we're gonna talk about psychological counseling referral letter and on how to write one. So, a well-written referral letter ensures clear communication between you and the receiving professional. In this video, I'm going to discuss the step-by-step process of creating an effective referral letter. Here is a sample of a referral letter my group and I made in the previous activity we had. Of course, first, we need to gather patients' details like their name, date of birth, gender, contact information if it's needed, and their medical history relevant to their referral. And then, let's start with the letter format. As you can see, we've indicated in the left upper part the name, position, address of the sender and the recipient. So it's from Lolina Bajin, registered guidance counselor from Camarines Sur Polytechnic Colleges. And we're going to send this letter to Dr. Isabel S. Lemen from Bicol Medical Center, Department of Psychiatry. Um, and after that, write a clear subject line. Just for example, Jamela B. Villar. RE stands for with reference to or referral for evaluation. In this part, we're going to write the patient's name. That's the patient's name, RE Jamela B. Villar. Of course, date of birth, November 10, 2002. After that, let's begin with a polite greeting. In this part, we've addressed the professional formally. Dear Dr. Lemen. And for our introduction, we introduced the sender's name, provided the patient's personal details, and stated the purpose of the referral. Dear Dr. Lamen, my name is Lolina Bajin and I am a guidance counselor at Camarines Sur Polytechnic Colleges. I am writing to refer Jamela B. Villar, a student in our institution, for a psychological support due to her symptoms of depression. Attached is a signed release of information permitting us to share her details. The client is a 22-year-old female, currently a fourth-year college student. I have had 4 sessions with her for a month now, and over the past weeks, Jamela has displayed symptoms of depression. In our last session, I asked her to make an appointment with you to ensure she receives accurate diagnosis, treatment, and support. In this part, we clearly explained why we are referring the patient because of her symptoms of depression. After stating the purpose of the referral, we provided the relevant information about the client. It includes brief medical history. In this case, the client doesn't have current medications or past treatments. And then we summarize the symptoms and behavior of the client. So Miss Jamela used to be an outgoing, active, and an academic achiever, but due to her concerning behaviors which are severe sadness, struggles with concentration, engaging in self-harm, withdrawal from her friends, and activity she used to love, I believe that professional assessment and intervention are necessary to address her mental health effectively. The client experienced these symptoms 3 months ago when she failed one of her subjects and may not graduate on time. In one of our sessions, she mentioned that she had trouble in sleeping, thinking that she may disappoint her parents once they heard about it. And because of that, she's having suicidal thoughts. She thinks it will help her to end her problems and struggles. I noticed that there are few cuts and scratches on her arms. When I asked her about it, she said that she has having habits of scratching her arms whenever she feels anxious or pressured. So straight away, we have addressed the symptoms and behavior of the client, which are severe sadness, engaging in self harm, struggles with concentration, withdrawal from her friends and activities she used to love. Mm. In the last part of the letter, we indicated what we hope to achieve and concluded the letter by offering further collaboration. After that, we closed with a formal sign off, sincerely, and the sender's name below. Um, Despite our efforts to support her, it is clear that she requires specialized professional care that extends beyond what I can provide. Please feel free to contact me if you require any additional information to assist in the evaluation process. I am confident that your expertise will provide Jamela the necessary support for her mental health. I look forward to hear from you so that we can be the most help to her. And of course, sincerely, Lorena Bajin. Mm, Thank you very much for listening. I hope you learned so much from this video.